Hi everyone, I'm Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. Today we're going to be discussing part 2 of newborn myths. All right, guys, if you missed part 1 of newborn myths, make sure you check it out. I'll link it right here. But today we're going to be talking about myths that are commonly perpetuated by society about newborns and newborn health. Let's start off with newborn skin health. I love talking about baby skin, moisturizing baby skin, but a lot of people don't know that the theory smooth as a baby's bottom or as baby skin is totally not true. Baby skin is not smooth. They have a lot going on in those first few days. This list right here is just a small list of the common things we might see happen on a newborn skin in the first few days to even first few weeks of life. And some of these can actually last for the first few months. Now, generally, people seem to think that baby skin is super healthy. That's not necessarily false when it comes to any of these findings, but it's important to understand that some of them are normal and expected, but they definitely don't yield smooth baby skin. When it comes to baby skin, I typically tell parents to go for a gentle, fragrance-free moisturizer and wash, and moisturizing is always helpful. Usually, I like those things especially because it's a nice way to also add in a routine for a baby, and we've talked about the importance of baby's routine for so long, especially in a whole playlist on baby sleep and sleep training for baby. Routines are so critical for a baby. It also just leads to comfort and having the baby feel more at ease. So having a bath tied in, appropriate bathing measures, safety in place, but also having a nice moisturizing regimen thereafter can also lead to having healthier skin. And so if you're worried about your baby's skin in the first few days, please make sure you talk to your baby's pediatrician. We can definitely talk you through some of the most common newborn skin findings. Myth number 2, more on skin. Blue hands and feet means baby is cold. So this is not necessarily true. This is something that we call acrocyanosis in the pediatric field. And this is actually very common. So again, baby's vascular development is kind of immature and their circulation is just getting used to all the different ambient temperatures once they're outside of the womb, which was obviously just one temperature that was controlled. It was one setting. When it comes to having blue hands and feet, I see a lot of parents trying to bundle their hands up. And really, it's not necessary unless you really feel like they're cold, but sometimes the risk of over bundling baby can be higher because you don't want to overheat the baby. So it's important to know that blue hands and feet don't necessarily mean your baby is cold. It can just happen due to immature vascularization. And especially because their skin is so thin, we can actually see that vascular network very, very clearly. So don't be alarmed. It's very normal. Myth number 3, no vitamin D is necessary as long as your baby gets sunlight. So this is not true either. And generally, I'll also give a little safety caveat here that when it comes to sun safety in babies, babies are at much higher risk of having a sunburn because their skin is so thin and immature, just like we just alluded to. So generally, I tell parents you can absolutely still give vitamin D. Vitamin D is great because it supports bone health, teeth development, helps absorption of calcium, but also helps in immune system development. And really all you need to do is 1 drop. So 400 units are usually what's in 1 drop, depending on what brand you find. You can always talk to your pediatrician about vitamin D drops and the best way to give them. But I would not rely on sun and the sun's rays for vitamin D, specifically if I have a newborn, because I'm going to want to protect that baby skin, especially because we don't routinely recommend sunscreen under 6 months of age. Now, other things really important to consider when you're talking about myth busting is sleep. Now, as I've mentioned, I have a whole playlist on sleep. But when it comes to this common myth that if you keep baby awake all day, they'll sleep better at night, that is not true. Please don't do that because it will make for a miserable you and a miserable baby because your baby will get up in the middle of the night. And sometimes there is a phenomenon known as habituation where your baby is kind of like overstimulated during the day, and that plays out into a huge fit at night. So I definitely recommend that you put your baby down for regular naps if you can, and just take the nighttime feeds as they go. Again, if you have questions about sleep training, definitely check out my playlist on sleep training baby, common myths, the different methods that we have. And we go through a lot of different questions when it comes to sleep training in this playlist. So there's a lot of great info. All right, last myth of this video. A colicky baby means parent is eating something wrong for them. This is not true. Please don't worry about this. Parents have enough to worry about without having to police their diet. Colic is a multifactorial phenomenon and diagnosis. Oftentimes there is no cause for colic, and there's definitely nothing a parent can do to prevent colic. So you can chase around your diet all you want. I would say please talk to your pediatrician before you start cutting random things out and listening to grandmas and mother-in-laws and friends. And even though they're well-meaning, cutting things out of a diet of a nursing parent or a parent who has just delivered, who needs all the calories, nutrients, and vitamins that she can get, is not a good idea. So definitely, if your baby is colicky, talk to your pediatrician before you start to make changes in your diet. All right, that's it, guys. I hope this video was helpful. If it was, give it a thumbs up. And of course, I will see you again next week. Bye.